Hi, my name is Lauren Hipsher.
And I'm Carey.
And I'm Jenn Wilson.
Today we're going to discuss wound healing. An article from the Wound Healing and Management Group asks the question, what is the best available evidence regarding the management of cavity wounds? The definition of a cavity wound is a wound that heals from secondary intention. These wounds are often left open so that they can heal from the base of the wound out. Typically, these wounds are packed with a ribbon gauze that's soaked in a solution which is either saline or antiseptic. The issue is these have a tendency to dry out and harden, causing pain and discomfort to the patient at dressing changes. They also increase the risk of damaging the wound bed further when they are removed. This article discusses the efficacy of several alternatives to this.
One alternative is the foam dressing, which is basically a silicone sponge, and it's widely used because it's a very absorbent dressing that can hold up to 10 times its weight in moisture. It doesn't affect the skin as roughly as the other dressings will. There's also a hydrofiber, which is to help prevent skin maceration as well. It's a sterile woven pad which is packed into the wound, and this actually turns into gel, creating a moist environment to support the body's healing. And then there are the negative pressure therapies, which are what we know as wound vacs, which are the controlled application of the subatmospheric pressure to the wound, and is using a sealed wound dressing on this wound, and it's connected to a vacuum pump, and it pumps the air out of the wound to promote healing.
Okay. Evidence lacks supporting one type of wound packing over the other, but alternatives to gauze were shown by the following studies. A level 4 study with foam over gauze for surgical wounds was associated with earlier discharge, reduced patient discomfort during dressing change, and a reduction in costs associated with materials and labor. No difference in time of healing was demonstrated by the study. Another randomized controlled trial, which was a level 2 of evidence, compares hydrofiber with provolene-soaked gauze, which is an antiseptic for packing excised surgical wounds, and this study reported an increased cost effectiveness and reduced pain at dressing change. A level 4 evidence study showed that negative pressure therapy increases local blood flow, reduces edema, stimulates formation of granulation tissue and cell proliferation, reduces soluble healing inhibitors from the wound bed, reduces bacterial load, and draws edges of the wound closer. A meta-analysis, which is a level 1 study, assessed the impact of vacuum-assisted closure compared with conventional therapy to length of stay and mortality for patients with infected sternal wounds. The study found vac therapy resulted in a decreased stay of 7.18 days in the hospital and had no significant impact on mortality. The best practice recommendations from this study concluded that assessment of the cavity wound must include size, shape, and depth of wound, presence of sinuses, type of tissue and wound bed, exudate characteristics, and any infection. The choice of packing materials and the frequency of dressing should be guided by the nature of the wound, etiology, and dressing material availability. Those are both grade A evidence. Vacuum-assisted closure therapy may be recommended for the management of cavity wounds, which was grade B evidence. Thank you.